This pansystolic murmur, which is heard at the lower left sternal edge and increases on inspiration, is typical of tricuspid regurgitation. Listen to a patient with tricuspid regurgitation. I will start with 3 normal beats and then add the murmur. This murmur is heard at the lower left sternal border. As with most right-sided lesions, this murmur increases during inspiration. Notice the respiratory variation of this murmur. Tricuspid regurgitation can be due to dilatation of the tricuspid annulus or to intrinsic disease of the valve, such as endocarditis, as shown here. When this murmur occurs in an adult with right atrial enlargement or a right bundle branch block, it suggests the presence of Ebstein's anomaly of the tricuspid valve. In this case, the tricuspid valve is displaced downward into the right ventricle, as shown here. A majority of patients with Ebstein's anomaly have some type of atrial communication between the right and left atrium, which may cause cyanosis. Cardiac decompensation may develop with the onset of atrial fibrillation in these patients. Both third and fourth heart sounds may occur in tricuspid regurgitation. Listen to the murmur of tricuspid regurgitation accompanied by a fourth heart sound. I will begin with normal heart sounds, and then add the fourth heart sound, and finally the murmur of tricuspid regurgitation. Patients with tricuspid regurgitation and severe symptoms, despite medical therapy, are candidates for corrective surgery, including tricuspid valve repair or replacement. If valve replacement is required, bioprostheses are preferred because of a high rate of thromboembolic complications with mechanical valves in the tricuspid position. Listen once again to the pansystolic murmur of tricuspid regurgitation accompanied by a fourth heart sound. Echo Doppler studies can visualize the displaced tricuspid valve as well as the tricuspid regurgitation. Listen once again to the murmur of tricuspid regurgitation and note the increase with inspiration. In summary, patients with tricuspid regurgitation may present with a pansystolic murmur at the lower left sternal border that increases with inspiration. Listen once again to the murmur of tricuspid regurgitation.